Okay, I wanted to finally make this video because I think it's necessary. But my name is Ronald Bazillion. I am a retired veteran after 16 years of military service. Um, I was medically retired in 2019, and I want to talk about DVTs in the military. Before I start, I wanted to make sure that people know what time, the date this actually happens. So as you see, February 10th, 2024. But I want to talk about a couple of, ask myself some questions about DVTs, PEs, and being in the military. So first thing is, can a person be in the military on blood thinners? That's actually a little bit of a complicated question. You can be in the military on blood thinners, but not permanently. You can be on a temporary profile when it comes to blood thinners, but if you are diagnosed with a permanent blood thinner diagnosis, you will either be separated under 15 years of military service, or over 15 years, you have the option of doing a medical retirement, which is what I was given, a medical retirement. What are blood clots and DVTs and PEs? Well, a blood clot is, this is pretty simple, but like when you have a cut, your blood will clot that cut so that the healing can actually take place. So that is called a blood clot. Pretty simple, but that's what it is. Now a DVT, which stands for deep vein thrombosis, that is a blood clot that can happen in your leg, and it may travel up to your arteries into your knees or into your groin, but it basically can lodge in your leg somewhere, and that can be very dangerous. But a PE is called a pulmonary embolism, and that is actually even more dangerous, where that blood clot travels maybe up your leg and lodges itself into your lungs. That is called a pulmonary embolism. So one of the problems with DVTs and PEs is that if you have if a blood clot in your leg or in your lung, if a part of that blood clot breaks off of that lodging in the lungs or in the leg and it travels into your heart, you can get a heart attack. If that blood clot breaks and it travels up into your brain, you can get what's called a stroke. That's why PEs and DVTs are very dangerous. So what are the effects of blood thinner medication? Well, like I mentioned, currently I am on Eliquis, and I would honestly say that the effects of blood thinner medication depends on the amount of doses that you have. So right now I have 5 milligrams. I've heard of people having more than that, having 10 to 20 milligrams. But in general, if you're on blood thinner medication, you have to be careful about getting bruises. It's much easier for you to get bruises, and that's the issue with blood thinner medication. Myself, at 5 milligrams, I've been on blood thinner medication since 2015, and I have not really had any changes in my lifestyle, a lot of training, things like that. I have to be careful about what I do and what I train, and of course, any blood, I've noticed when I do get a cut, it takes a little longer to heal up, but it does heal up. But that's some of the effects of blood thinner medications. Can you work out, train, and do things as you normally did on a blood thinner? The answer is yes. But similar to the last question, you have to be very careful about what you do. So if I'm doing jujitsu or any hardcore impact type of sport, you're going to have to be very careful about what you do. I've been doing kickboxing since 2015. Heavy bag kickboxing more than anything, and I have not had any issues with that. Do I have bruises? Yeah, but to be honest, no different than any time I've trained without blood thinner medication. Now, like I said, on 20 milligrams, you're probably going to have you may just bang your head against a against a table, and you may get a bruising that way. So, depends on the amount of medication you take. So, I take 5 milligrams. 5 milligrams every 12 hours. So what does a DVT feel like, and what are the symptoms? Okay, so this is what I will explain what happened to me in 2015 and 2016. So that soldiers know, or any person knows, what the symptoms are like and what I experienced. So in 2015, I'm still interested in training and I do a lot of I'll do like heavy like a lot of shadow boxing. I'll have a 40-pound weighted vest, 1 pound hand weights, 1 pound foot weights, as well as an oxygen mask, and I would do a lot of hardcore training with shadow boxing, even doing that type of workouts, and I enjoyed that. I think one day I did that type of training for an hour, and I felt a lot of soreness up in my upper body. And I'm thinking, okay, I'm getting older. I'm in my at the time in my 40s. Just what it is, just how life is. And so I went to the VA, and they gave me a shot to relax the muscles. So that was fine. I felt good. Kept relaxing, kept doing things. Eventually the soreness went away. Then I went back to training again, slowly built it back up, but then I went back to what I was doing before. The soreness came back, and I said, okay, let me chill out on that type of training. But what ended up happening was, and this is where I highlight this, is when I was sleeping, and I do recommend it, take a finger and you push into your ribs as hard as you can. Like just do that. So when I was sleeping, that's how it felt. Like something was pushing right into my ribs. And I couldn't sleep. So I did like any person. I would just turn over, and the feeling went away, so I could still sleep. Eventually, it still felt there still was some pain. So I started sleeping on a chair, and that felt better. So I would did that for about a week, and I was still going to work, just healing myself back up, doing things like that, not doing any training, just figuring I'm just sore, just relaxing. And I would say probably the week before Halloween, I still feel that pain if I lie on a certain side. I felt shortness of breath, but there was one day where I spit into a sink, and I coughed up blood. And it wasn't a lot of blood, just a little bit. But that was enough for me to say, okay, time to go to the VA. So I went to the VA, told them my situation. They gave me a chest x-ray. And that's when I heard the nurse say, like, I'm in the room listening in, and I hear it, and this person I think is looking at my x-ray, and they say, this guy's got a massive PE. And I'm like, what's a PE? I don't know what a PE is. And of course, they said, look, one of the nurses came in and said, look, you're not going anywhere. We're going to move you up to up to the ICU. You're in a serious situation. You need to call your wife and bring her over here. So, and I did, and I called her over, and they let me know what was happening, that I had two PEs in my lungs and 2 DVTs in my legs. And they were not allowing me to go anywhere. They said, look, you go to the bathroom and die. That's how bad it was. So I went to the ICU, and they put, there is I don't know the name of it, but they basically put some kind of drip into that breaks up the PE in my lungs and the DVT. So that's why I'm in the ICU for a couple of days. But that's how it felt for 2015. Eventually, for about a week, I was in the hospital. I got out of it. They kept doing ultrasounds of my leg, as well as a chest X-ray once in a while to see if that PE had gone away. Eventually, it broke up to a certain point where now I'm on Coumadin. So I'm on Coumadin for about 3 months. They said you could stay on for 3 months or 6 months. Of course, I choose 3 months. Did that. So I'll talk about Coumadin and Eliquis and Xarelto later, but that's what I want to give you explanations of how it feels. And that's important for soldiers to know that, or any person to know what it feels like. But now I'll go to the next question. So what blood medications have I been on? Coumadin, Xarelto, and Eliquis. Okay, so I'll explain those medications. But Coumadin is a blood thinner medication. It's kind of the tried and true blood thinner medication that everybody knows. The thing with Coumadin is that you take it. I think it's you take it either every day. It's been a while, but I think you do it every day or every 12 hours. But I think it's every day. But you have to take. I think every 2 weeks you have to have a blood test to make sure that your blood is thin enough. And then on Coumadin, you can't have salads. You can't have anything with vitamin K because that hinders the blood thinning process. So that's something that you have to be careful about. So I did that probably till about 2016. I did it for 3 months and then got off of Coumadin. I was excited, got off of it, ready to go. That chapter is behind me. Then in 2016, after an APFT test, I felt about a week after that APFT test, I felt a poke in my side again. It wasn't as bad as the last time, but I did feel it. That's when I knew this is serious. Let me go to the VA, check myself out. They did the chest X-rays. They said, "Yep, you have another PE." Now, after 2 issues of PEs, now the doctors will say that you have to be on a permanent blood thinner medication. And that's why I say what I say, is that the first big PE from 2015 was not something that can kill your career. It is the second one where the doctors say that you have to be on this blood thinner medication permanently, that the military will either separate you or retire you out of the military. So hopefully you understand that difference. One thing I want to mention with Xarelto and Eliquis is that Eliquis, I believe I only take it once a day. You don't have to watch your diet as much as Coumadin. I've had salads, not a problem. I've also in 2020 I switched over to Eliquis, and Eliquis is 5 milligrams. I take it every 12 hours. That's what I take every day, every 12 hours. I would say that my lifestyle and training has not changed. I do a lot of HIIT training. I do a lot of lifting. I do a lot of kickboxing. I'm always cautious about what I do, but I can still train at the level that I want to train. But I wanted to make this video, and I'm hoping that I put as much detail as possible, but also to explain what happened to me. And it's good that somebody will tell you this is what I experienced, so that you can make your decisions and make your choices. One thing I will mention is in 2016 I did my PHA, and I had a major, a PA major, and I had told him that I was on Coumadin at the time, and he said that you cannot deploy being on Coumadin, but he said if you can get on Eliquis, then you can deploy. The reason I bring this up is that that's false. If you are on any blood thinner medication, you cannot deploy. And because of General Mattis's letter saying that you have to deploy, you have to deploy within 18 months. And if you can't deploy within 18 months, that's when they start doing the paperwork to get you out of the military or retire you. But I wanted to make this point clear. The reason I bring up the PA is because it's possible that these PAs just don't know. And the reason I bring up what I say is that I went through what they call a PEB, a Physical Evaluation Board. I think it's a Physical Evaluation Board. And because of that Physical Evaluation Board, they said, Ron, you cannot serve in the military anymore. You have to leave. So it's now PEBs are case-by-case basis, but after looking on the internet, there's not a lot of information to tell soldiers this is what happens. This is what it is, and this is what can happen, so that you can make your decisions. So I'm making a video myself so that soldiers can have better knowledge and understanding, so they can make their decisions. Thank you very much, and have a nice day. All right, bye-bye.